My name is Sarunas Tarasevicius. I work as orthopedic surgeon. My main field of interest and the main field of clinical practice is total hip replacement. Annually, I do around 200 procedures per year, and my current practice in the field is more than 10 years as orthopedic surgeon. Total hip replacement is one of the most successful procedures in general orthopedics, and the success rate is around 98–97% after 10 years after surgery. That means that when you do a hip replacement after 10 years, only 2 or 3% of patients needs additional surgery, and the remaining patients feel good and they don't require any additional surgery and they don't feel pain or any problems with their hip. We have a well-established hip replacement register in Lithuania, which makes our work comparable with the Scandinavian countries, and we can achieve the same clinical outcome as it can be achieved in major Western countries of Western Europe. The main indication for hip replacement is arthritis, and around 90% of all patients which comes to the hospital suffer from a pain in the hip, and usually the reason of this pain is degenerative arthritis of affected hip. We have a very wide selection of implants to resolve this problem, from cemented implants to the most modern and sophisticated and new uncemented implants. The implant selection is usually based on patient's related data. The main object when you select an implant is patient's age, activity level, and the patient's expectation. If the patient is young, active, and he's expecting to do any kind of sport activities after hip replacement, usually the uncemented hip replacement is selected with a special sophisticated bearings, including ceramic and the modern polyethylene bearings. If the patient is older, more than 75 and 80 years old, usually cemented implants are selected as they can ensure the best outcome results for this particular patient's age group.